I have my patient's record, and I'm going to compare that to the MAR. So I'm going to compare that I have the right patient. It's already been initialed, so I know it's been compared with the doctor's orders. I have the right patient, the right drug, ibuprofen, 400 milligrams, the right dose, the right route, orally, and the right time. It is 8 o'clock in the morning. Second one is amoxicillin, so I have the right patient, Tom Slick, the right drug, amoxicillin, the right dose, 500 milligrams, the right route, orally, and the right time, 8 o'clock. So I'm going to wash my hands. I'll pull out my drugs. Alright, so I'm going to do my second med check, or my first med check. This is my first med check. So I'm going to check that I have the right patient, Tom Slick, the right drug, ibuprofen, the right dose, 400 milligrams in a tablet, the right route, orally, and the right time, morning, 8 a.m. My next drug, I am going to check the right patient, Tom Slick, the right drug, amoxicillin, the right dose, 500 milligrams, the right route, orally, the right time, 8 a.m., and in the morning. So now I'm going to do my second med check. I have got the right patient, Tom Slick, the right drug, ibuprofen, 400 milligrams, the right dose, the right route, tablet, which is oral, and the right time, 8 a.m. Today is the 15th, so I'm going to pop out number 15. That is my ibuprofen. Second one is the right patient, Tom Slick, the right drug, amoxicillin, the right dose, 500 milligrams, the right route, orally, tablet, the right time, 8 a.m. and morning. So I will pop that one out. These can now go back in the drawer. I'll grab a glass of water for my patient, my drugs, my MAR, my patient's chart, and go to my patient's room. Knock, knock.
Come in.
Good morning. My name is Rosalind. I'm going to be your nurse today. How are you feeling right now?
Just a little bit sore.
Your abdomen is hurting a little bit? Okay, well I have some medications for you that your doctor ordered. Could you tell me, this chart, could you tell me your name and your birthday?
Tom Slick, 10/15/69.
Alright. So are you experiencing any pain right now?
Yeah, just in my stomach mainly.
Okay, on a scale of 1 to 10, 1 being very little pain, 10 being worst you've ever felt.
Oh, it's probably a 6.
A 6?
Yeah.
Okay, well I'm going to get some vitals from you really quick and then we'll go ahead and give you some medications. And then somebody's going to come in about half an hour and change your dressing for you, okay? Okay. So is this just to get your pulse and O2 sats? how'd you sleep last night?
Not too bad.
Good. I'll take your temperature last and we'll get you your medications, okay?
I'm gonna go ahead and clean up your foot. Let me know if I hurt you in any way.
I'm just gonna go on your forehead.
Okay. How'd that feel?
Alright. So I'm gonna go ahead and compare the MAR to your bracelet. Can you tell me your name and your birthday one more time?
Tom Slick, 10/15/69.
Okay. And then your first medication I have here is your ibuprofen. That is given to you for pain. So since we're going to be changing that dressing in about half an hour, we're going to give this to you now so it has time to kick in, so it won't hurt, and so you'll be feeling better, and hopefully we can get that pain down a little bit.
Okay.
It's 400 milligram tablet. So I've got the right drug, I've got the right patient, the right drug, the right dose. It's an oral medication, and it's 8 o'clock, so we'll be giving that to you. And then your second medication that I have is amoxicillin, and that is given for, it's a prophylaxis, so we're hoping to take it, we're hoping to use it to prevent an infection.
Okay.
So it's an antibiotic. And so I've got my right patient, Tom Slick, my right drug, amoxicillin. It's 500 milligram tablet, and you'll be taking it orally, again, at 8 a.m. So let me give those to you, and I'll grab you some water. Do you have any questions about your medications?
No.
Okay, so hopefully I'll just make you feel better and get you all set up. Alright, well someone should be back in about half an hour to change that dressing for you. Alright, can I do this for you? Do you have any other questions? Okay. I'm going to lower your bed. And here is your call light if you need anything, okay? Alright, you're welcome.
I'm gonna do a few things this morning. I'm gonna go ahead and get your blood.
Come in.
Hi Tom, I'm Tia. I'm going to be your nurse today.
What are you gonna do?
We are going to assess your wound and change the dressing on it to promote better healing, okay? How are you feeling since your medication? It's about 20 minutes ago, half an hour ago?
The pain's a little better.
Okay, you think you'll be okay to do the dressing change now?
Yes.
Okay. All right, well, I'm going to get some things set up here, okay? Let me see. All right, can you state your first and last name for me?
Tom Slick,
And then what's your birthday, Tom?
10/15/69.
Okay, I'm going to raise the head up just a little bit on the bed, okay? Let me know if that's uncomfortable for you.
Okay, stop.
Okay, and then we're going to bring the bed up, okay? I'm going to get some stuff organized here, okay? had this done before.
Yes.
I it didn't even work, so just so you know. Take a temperature.
I would wait for David to talk.
Yeah, I did kind of wait. I mean, that was okay. Should we do? Tom, how are you doing this morning?
Alrighty. Let's take a look at you here a
Well,
second.
I want to see how you are. What you're, yeah. How are you doing this morning? Okay, on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you've ever felt, can you tell me the
Get our little garbage sack out here for all of our drainage and
We're gonna see
stuff.
what we can do about that, because we have a couple things that we need to do today. We're gonna do a dressing change on your heel, and also I'm gonna do, well, I'm gonna go back and see if I can do something to help with that pain. I'm washing my hands, on that side. Collar.
Okay, I'm gonna remove this dressing on you. You let me know if it's uncomfortable for you, okay?
Trying to hurry, so we can get us here. That was 4 minutes. Okay.
How you doing?
It's okay.
So then you come out here, right? I'm gonna, I see that Tom can receive a Tylenol PRN for pain. I'm gonna go ahead and get a glass of water.
Okay. Doing okay still?
Yep.
Okay. What we're gonna need to do is I need to put a blue pad underneath you so that we can irrigate the wound, and then we're gonna do a culture and stuff, okay?
Tom, I have Tylenol, 650 milligrams, PRN, by mouth. And it is 9 a.m. First check completed. Alright, I'm gonna grab another tissue. Pop that out of there. Alright. I'm gonna go ahead and do my second. Oh, I guess I will do the second.
Yeah, you can call.
So I'm gonna go ahead and do my
Just
second
gonna
check.
kinda
I have
lay this out down here, okay?
Tylenol, 650 milligrams. PRN.
Just to catch the fluid as we're irrigating and stuff, okay? Alright.
Second check is complete. I'm gonna grab my mom, my glass of water. Knock knock. Knock knock.
She's like, hello.
Hello, Tom. I'm gonna suck a few things down and then I'm
Okay, we're gonna measure this site here quick, okay?
You give me your name and date of birth. Okay. You would do that anyway when you walk in the room, right? And then you do the math. Okay. I have your Tylenol for pain that you're experiencing today.
It's about a 2.5.
Okay, I have Tom Slip, and I have 220/63, and I have Tylenol, 650 milligrams, PRN by mouth. Third check complete. Here's your water, and there's your med.
Okay, we got those measurements. Now the other thing I need to do is that I need to stick this in your wound and just touch the sides of your wound a little bit, and you need to let me know if it bothers you too much, okay? We're checking for abnormal pathways or fistulas, okay?
And then I'm gonna go ahead and come back in 30 minutes, and then I'll assess your pain again, and then we'll see if we can go ahead and
Looks like
do
it's
your.
okay, and it looks like you're healing here. It's getting a little bit better.
Still looks gross.
Stop here. Put my med, just like that.
It's just a wound. Everybody has wounds, and it'll heal up, and you probably won't even notice it much anymore.
All over. Alright. Okay, and then I'm signing. And she said it doesn't matter if you do this.
Okay.
You're still okay. I'm gonna
I need to get myself some sterile water here.
I'm going to have my
So now we're gonna get you irrigated and clean that wound out, okay? And then from there, we'll take a culture, to check for any kinds of infection or anything going on. Because I know that you're on taking amoxicillin right now.
A dry dressing change for me. And go ahead and meet me in conflicts room. No. Okay. Knock, knock. I'm just gonna come knock in. Hi, Tom.
And we like to look really cool in these things, so that's why we put them on.
Right now.
They're pretty chunky.
Yeah.
On that scale of 0 to 10, what would you rate it at right now? Okay. So I think that we can go ahead and start our assessment then. Tom, I'm going to go ahead and uncover you because I'm going to do an assessment. And remind me to make the bed go down.
Okay, so we gotta fill this syringe up.
So it's not as huge. Okay. So Tom, I'm going to go ahead and assess. Okay, so I'm going to go ahead and assess your scalp. I'm just going to look and see if you have any other problem areas. Okay, good. I am looking for edema also. I don't feel any edema in your extremities, your upper extremities. I'm going to come down here. Alright, nothing there. Okay, I'm going to go ahead and
Okay, so you've had this done before. We're gonna irrigate the wound there. And you let me know if you have any discomfort at all, okay? And that little pad at the bottom should catch it there. Alright, so I'm gonna irrigate from superior to inferior on the lateral sides.
start the dressing change if that's okay with you. Okay, I'm going to wash my
And then
hands.
from the top to the bottom.
I have an assistant
Okay.
here who's going to help me with the dressing change.
A little bit of that there.
I'm going to go
Okay.
ahead and wash this off.
Alright, so now we gotta get this culture, okay? So again, I'm gonna have to touch inside your wound a little bit, okay?
And I'm going to put a little sheet down here, a little, what do you say about it? I call them chuck. I'm going to put a chuck down, but don't get all
Get that label, that's where we write the measurements down and stuff, okay? Alright.
I'm going to go ahead and for chuck, I'm going to put
Still doing okay?
Yep.
Okay.
we're going to Alright, this is just going to protect the cover.
Alrighty. Get your name put on this culture so we can get it sent out to the lab. You warm enough?
Yeah.
Your belly's kind of hanging out there.
Yeah.
Yeah, Charlie. We have another thing. I have to get on that. So we have everything? Are they gonna-
Time it is. Okay. I'm gonna wet this gauze a little bit, and then we're gonna put it down in your wound, okay?
They have their own.
Got my sterile solution here.
But I'm gonna take it.
Cut.
Yeah, and this one I don't have to raise the my finger. Not really for the blood pressure. For the blood pressure. Or maybe we should put this over the top of it. Then.
Alrighty. Now we're gonna go back. Okay, you let me know if this bothers you, okay? I'm just gonna loosely put this into the wound here, okay? How's that doing, okay? Okay. I'm gonna place these over the top here, okay?
I see the nice new words for conflict. Conflict means the dressing change. And also PRN mud as we if it's needed.
Still doing okay?
Hello.
Glad it's almost over with.
My name is Autumn and I'm the nurse. There's a few things that I need to check this morning. You, can you give me your name and your birth?
Yes, I got it, and I just got my homework printed yesterday. That was over pretty much.
Okay. All right, Tom. Your physician has ordered.
Alright, we just need to put this bigger pad over here now, okay?
Yeah.
But before we do that, I would like to go ahead and get your blood pressure.
And then I'm gonna put some tape on here. Not allergic to any kind of tape, are you? Okay.
Is it hot in here or is it hot in here?
One more piece to go here. Alright, and then I need to sign my name here and date and time so that other people know when we change the dressing, okay?
Beautiful.
Okay? Still doing okay?
Yep.
Okay. Just cover back up here. Okay. Alright, I'm gonna lower your bed back down for you, okay?
How are you doing today?
You okay sitting up like that?
Yeah.
Okay, I'm gonna get the supplies cleaned up here and then we're gonna kinda take a look at the skin, the area around the wound and, the rest of your body a little bit, okay? Alright.
Alright, now that I've got everything cleaned up, I'm gonna do a head to assessment on your skin just to make sure that everything's alright. And I'm gonna adjust your bed if that's okay?
That's fine.
Okay.
What would you rate your pain at?
I'm gonna lower right your
I
head.
think we can go ahead and do your physical assessment or your skin assessment, if that's okay with you. Okay, I'm gonna go ahead and move the bed up just a little bit higher. Okay, Tom, I'm gonna go ahead and check the back of your head. And just see if you have another problem area. Tom, are you able to lean forward so I can check your back?
Okay. So first I'm gonna look at your hair and your head. Alright, and I'm gonna pinch your neck if that's okay.
Okay.
Checking for your trigger. Okay, looks good. And let's see, I'm just gonna palpate your arms. Make sure everything is good. And then move down to your legs if that's alright.
Is there anywhere that hurts? Any places hurt at all? Okay, no, Gina.
I'm gonna check for edema
Other side, no.
and make sure there's no swelling. Okay. Do your other leg. Your skin looks good. No edema. Alright. Oh, and I'm gonna check your refill. Check for clubbing. Okay, looks good.